Hello everyone, my name is Caroline Lecalvé. I am a data analyst at Imperial College Healthcare and NHS Trust and a research assistant for the Computational Oncology Group at Imperial College London, and today I am glad to talk about Gliocova. During this presentation, I explain why we designed this project, what it is, and what we can do with it. To understand why this project is important, let us put the incidence of primary brain tumors in context with the other cancers in the UK. Each year in the UK, there are more than 360,000 new cases of cancer, and half the patients will survive more than 10 years. Out of these new cases, about 12,000 will be of brain tumors, and about 12% of the patients will survive more than 5 years. Finally, out of these 12,000, around 2,000 cases will be of grade 4 brain tumors, which are the most aggressive type. Only 5% of these patients will survive more than 5 years. Therefore, brain tumors are a leading cause of cancer death in the under 40s. Although brain tumors are rare, they have a disproportionate impact on cancer survival, and there is no national brain tumor audit to monitor patients' care and outcomes, and these are the main reasons behind the importance of this project. National cancer datasets allow us to understand the epidemiology and outcomes even for rare tumors. The Gliocova project offers us an opportunity to study both patterns of care, variation in care, and outcomes at a national scale. The Gliocova project uses a comprehensive linked national dataset provided by Public Health England. We requested data on all adult patients diagnosed with a primary malignant or benign brain tumor in England between 2013 and 2018. Gliocova therefore holds data on more than 50,000 patients for us to understand patients' pathways and outcomes across the NHS. Gliocova includes data on patients' demographics, incidence, treatments such as surgery, chemotherapy and radiotherapy, but also hospital admissions in the NHS and death. As a bonus, we also have an extract of the National Cancer Patient Experience Survey. The blind spots of Gliocova are mainly around primary care, the silent indications taken by the patients during the treatments, and everything regarding social care and quality of life data. With the richness of this data, we started to get questions from the brain tumor community, which includes patients, carers, charities, clinical staff from various NHS trusts in England, and experts in various domains. With almost 52,000 patients included in this dataset, we discovered that the median age at diagnosis was 64 years old, that 9% of patients with malignant brain tumors managed to finish 6 cycles of chemotherapy with a drug named temozolomide, chemotherapy that is usually prescribed after 6 weeks of radiotherapy. We also discovered that about 2% of patients with a grade 4 brain tumor died within 30 days post-surgery, compared to less than 3% of patients undergoing surgery for colorectal cancer. As part of this project, we have frequent meetings with the brain tumor community to get relevant questions such as the care received before death, the admissions as inpatient, and the costs associated. We are actively working on nosocomial infection and patient safety events following neurosurgery, and we hope to present results at an upcoming international conference. We are still at the beginning of getting answers. The results are what we would expect and are in line with the published literature. With this project, we hope to redefine what matters most to the brain tumor community, but also to be able to better plan clinical trials around brain tumors. A lot of people are actively working on this project, but there are a few people I'd like to acknowledge. I'd like to thank Radville Morike for her work on analyzing and producing comprehensive results, Lily Baghdad-Shahabi for organizing PPI sessions on a regular basis, and Dr. Matt Williams for his ongoing input and support. Thank you for listening, and if you'd like to know more about this project, we have a blog with oral presentations given at past conferences, articles presenting our latest findings, and links if you wish to join us.